nursing documentation is probably one of the bedrocks of looking at any patient. When we review data of any patient, I think so nursing documentation has been the bedrock of it. Being a doctor, I can just when I don't have any hesitation in sharing that sometimes the doctor documentations, medical documentation is not as appropriate as nursing documentation is there. So while we discuss this, I think so today we have a stellar panel of 4 senior members from the healthcare sector. So it will be interesting to see, and we'll interact and we'll hear their opinion on what all to do going forward and on the nursing documentation as we look at it, the rational essential documentation for effective patient care. So what I'd like to say is that what is the basic purpose of documentation? The primary purpose is obviously to facilitate information flow that supports continuity, quality, and safety of the patient. And with it, attendant things are always there, like accreditation, accountability, legal requirements, the financial part. But overall, the most fundamental thing is patient care. How do we plan for care? How do we hand over? How do we ensure that if you look at as time has progressed in the healthcare sector, nursing has been burdened with a lot of documentation, lot of paperwork. So I think so this it will be a good thing to sort of brainstorm on what to do and how do we reduce their paperwork and not slow the productivity. Coming to Dr. Sanjeev Singh, so this is something about nursing documentation in the sense that we've heard about HANDS, which is on the hands-on automatic nursing data system. Because now data is showing that if the overall documentation as far as nursing is concerned is improved with online EHR. So I just wanted to pick his brains on this, on what are his thoughts, and because something on these lines also we are planning, Sanjeev, in our setup. So I just wanted to bounce it with you and take your thoughts on this, and this will be a good learning for others also who are hearing this. Over to you, Sanjeev.
Thank you, sir. Thank you for that kind introduction, and it's always a pleasure being with you. But to answer your question, I think it is very important because we have seen, and you were mentioning in your introductory lines that we depend on nursing documentation. They are the front bearers. They carry out most of the work which is being done within the clinical care. And a small study which was done at our setup, we also realized that unfortunately they spend a lot of time in documentation. So almost 35%, that is close to 147 minutes of the time is taken in documentation. There is close to 17% of the time which is taken in medication administration and care coordination, because any clinical team will come in and say that echo is required, or a cardiology clearance, or a pulmonary clearance, or anesthesia clearance is required. So there is close to 20% of the time, which is 86 minutes, is spent on just on care coordination. Plus the patient care activity which is there, which is only 19%, 81 minutes, and then they have their own nurse practice time. So ideally there is very less time for them at the patient bedside, and that is a disaster. And unfortunately bad administrators like me add on an electronic health record system, and then it is a completely disintegrated system, because we want them to maintain somewhere physical records, manual record, or somewhere we wanted an electronic health record. Those who want to introduce electronic health record always believe this would save time, and those who have introduced it, they realize that it is almost been parallel for this manual versus EHR. But if the system is very well integrated, to answer to your question, sir, if the systems are very well integrated between how the nursing and the clinical care team have asked for it, asked for preparation of electronic health record system, they have closely coordinated with the IT developers and programmers. They maintain what is actually realized and what is required. Gracie mentioned almost, it looks like 142 case records, which is required along with the care plan, which was such a short word. Getting all of this in electronic health records is a Herculean task. But those who have adopted it have demonstrated that it has done well. It would be just on a click of button. We need to make it very user friendly so that all vitals, intake, outputs, and all the progress physicians and nursing orders are also sort of maintained. Unfortunately, we waste a lot of time. Like in nursing, we waste almost 50% of the time in duty roster, because they are calling for leave and they are not available. So if we can sort of integrate it all well, make it all sort of very well defined, then moving into an electronic health record where it is very well coordinated between the IT, clinical, and the nursing, and if it is delivered well, it is such a pleasant way of delivering nursing care. One last example is again a personal example where quite many years back, my wife was admitted for a biliary sludge and a ERCP was done. And unfortunately, she landed up in a post-ERCP pancreatitis with a pleural effusion and a pericardial effusion and a burst abdomen and paracolic abscess, and multi-drug and a pan-drug resistance, and we almost lost her many times, and she was admitted in the hospital for 6 months. What we remember and what we cherish during her very, very difficult time is nursing care. And the time the nurse spent with her during her very difficult, anxious, and depressed days by her bedside. And we don't remember anything about documentation. So I think that is important. Over to you, sir.
Thank you, Sanjeev. It was very succinct and very, what do you call, good pieces of wisdom for everyone.